Trust is actually the currency of digital health. Without trust, no digital tool will become embedded into the ecosystem.
There was one nurse that said, it's quite unethical not to offer these elderly people this technology. We use it all the time.
In reality, it has the potential to support the professionals and improve patient or client care without removing the human touch.
Get to a point where digital health is invisible because it's just the way that we deliver health and care.
Ecosystems in Health and Care, the THCS Podcast.
In episode 5 of Ecosystems in Health and Care, the THCS Podcast, we talk about the digital threat. It's not about tech for tech's sake. Digital health only matters when it works in practice, in the hands of professionals, inside real workflows, and in the everyday lives of caregivers and citizens. I'm talking to Donna Henderson, Head of International Engagement at NHS Scotland, who brings a European perspective on how digital health is actually adopted in real ecosystems. Etty Nilsen, representing the project CoTecH at the University of Southeastern Norway, a national partnership shaping digital services and building capacity for digital ecosystems. And Elisabeth Haslinger-Baumann, Vice Rector for Research and Development at the University of Applied Sciences Campus Vienna, presenting LinkedCare, an ecosystem experimenting with interoperability and building trust in digital care. I'm your host, Ursula Yasin, with Red Swan Vienna, Austria, and it's my pleasure to interview the lovely guests of the THCS podcast.
So, Etty, in your experience, what excites people most about digital health and what scares them the most?
At least people that have worked with it a little bit, what excites them is the opportunity to be more autonomous for the users and also for the healthcare workers. And also to have a more dignified and private healthcare treatment or service. But at the same time, the other side of the coin is what scares them the most is the lack of, the lack of warm hands.
Oh, yes.
And to have, technology substitute the warm hands, and that's what scares them the most. And of course, this is a big issue that I could talk about for a while, but in a nutshell, that's what it is, I think.
And how do you tackle this problem in Norway, for example? We always try to learn from the Nordic states, so I hope you have some advice for us.
Yeah. Well, it is actually not that easy because changing the mindset of healthcare workers and patients is a long stretch, actually. But I think that it's not only a question of convincing them, but it's also a question of realizing, what situation we are in with the lack of healthcare workers and that we have to take some measures and use technology where we can. And that means maybe saying that the healthcare workers that we have, they can actually work close to the patients and have more time for that if we reduce the workload in some ways.
And what's your perspective on that, Elisabeth? In your experience, what excites people most about digital health and what scares them the most?
This is an interesting question because every digital system has at least two aspects, a positive one and a scary one. On the one hand, people have concerns about data protection. And on the other hand, people are excited since it might simplify work procedures.
Yes, it might. What did you do in your project, which is called LinkedCare in Austria, to make people trust in it? Did it have any measures for that?
We include an ethical and legal institution from the University of Vienna. So they were mainly focused during the entire project to find out ethical issues and data protection so that we can establish a really safe and secure procedure of sharing information between different health professionals.
Donna Henderson, what's the first digital tool you think of when you hear the word ecosystem?
Well, for me, when I think about ecosystems in health and care, I don't think of one app or one platform. What I think about is this digital thread that connects people and services and data. So for me, that digital thread in reality means interoperability. What is it? Our shared health records, our interoperability platforms. What is it about them that, well, they are the things, they are the tools that connect that ecosystem. And if they don't talk to each other, then they're not serving the ecosystem. They really only serve themselves. And so that's what I think about, when I think about that first digital tool.
You mean people talking to each other or talking in the digital services to each other?
It could be all of those things. So it's about the data and where it sits around individuals. As we know in health and care, our data as citizens, as patients, sits in multiple systems. And we'll never have one single system. Of course we won't. That's never going to happen. So the thing that connects them is interoperability between that system level, that technical interoperability. So that's one thread. Then there's the people. How do we use digital tools to connect people? And again, for me, interoperability again is the way that you connect them. So that's about how you connect the people to the right system, the right service at the right place at the right time. And again, we're using digital tools and platforms to enable that. There's not one, there are lots. And I think similarly with services, our experience over the years with health and care services is that they operate very often in silos. So, how do we actually connect them together so that services can feel for the citizen as one service, streamlined, that they don't fall between the gaps, which I think is very important. And again, that's where digital solutions come in.
Etty, can you share a moment when a digital tool actually made care more human rather than less?
Yeah, what popped into my mind when I was reading that question, I was thinking that, give an example from using sensors in diapers. This is the
Can you unpack that?
Are you sure you want me to unpack that? Yes. Well, for sick people or elderly, you would use a diaper, and sometimes you need to do that. And what the healthcare workers would do is they would go and check if the diaper needs changing. It's not a very dignified, situation for the patient. Now, if you have, and especially when this needs to be checked, maybe you wake the patients up. So if you have a sensor that will give you a signal when the diaper needs changing, in a way that will limit that situation to when it actually needs to be done, that results in a more dignified and more human health service given.
Yeah, so you actually give them dignity back, a degree
Yeah,
of dignity
yeah,
back.
and I think that that's sort of an opposite of what you would maybe think
Yes.
about a sensor in the diaper. I mean, this can obviously be used for babies too. It's not
Yes.
it's not only for
But they
sick
are
and
not
elderly.
ashamed about changing
Not
their
usually, not
diapers.
usually. That's true. That's true. But that it could also be environmental friendly. That you would only do it when it is really needed.
And what's your perspective on that, Donna?
My perception is that, for digital, that it actually creates the time and the space for human facing care. And particularly in this time when we're facing huge challenges with having, with our health and care workforce, we've got shortages across the piece and a much larger aging population where, we as older citizens perhaps need more health and care services. It's absolutely critical that we use digital tools to really maximize the human care and contact that we have. So for me, that's where really digital is going to be a lifeline. It's going to create that time and space, as I say, for that human interaction where we really need it and not for unnecessary things.
We jump back to Norway. Your project, CoTecH, it has been described as a capacity building ecosystem. What does that actually mean in practice?
Yeah, these concepts of ecosystem and capacity building are maybe, estranging us a little bit, because what we're talking about here is increasing the knowledge base and the competence and the abilities and capabilities of the actors in the ecosystem. So what we're saying that, the development of the ecosystem is not better or stronger than the weakest link in a way. So when we have, for instance, university as a knowledge builder or deliverer, and the healthcare workers as important actors in practice, and the patients and the industry, then we need to increase the competence with all these actors in order to bring this field forward. That's what it means. But the thing is, previously, we haven't been clever at actually mapping the whole ecosystem and seeing that, yes, it is also important, for instance, to have the industrial actors with, like you mentioned. And it's also important to see that the healthcare workers for instance, also very important users of the technologies, not only the end users, and so on and so forth.
And how do you tackle that in your project? How do you bring all these people together?
Yeah, that's what this CoTecH project is all about.
Ha.
It's bringing all these people together. We have a very long list of participants from all these different groups that I mentioned, including user groups and public agencies that are important in this. And we use a special method that we call co-creation. And we actually bring people together physically, which is not only physically, but also physically, which is important. And they work on first mapping, what are the issues that we should be working with, and then we try to connect them, which is challenging because there are silos. So this is very much what it's about.
And how do you reach the silos?
As a networking, if
Talk
that's
to
what you mean.
people.
Talk to people, but
bring
we
people
have
together.
worked with this from the Center of Health and Technology. We have worked with these same issues or the similar issues. It does change, of course, but close to 20 years, 15 years. And so we have a very big network regionally and nationally and also internationally on
Just to
these
get an
issues.
impression, how big is that network? Like, how many people is it? Hundreds, thousands?
Oh, that's impossible to say. Networks are very personal in a way, so I think you'd have to go to each person that's connected to it. But we are in the Center of Health and Technology. We have about 50 researchers. All of them are in the CoTecH project. But there's a bigger organization also, a lot of work packages with work package leaders and mentors and so on and so forth. All the 4 faculties at the university are engaged in this, and which doesn't maybe sound that impressive, but it's quite difficult actually to get the faculties to work together. Yeah.
Yes, it is. It is. Now we go south. I don't mean that in a negative way. From Norway to Austria. We just jump back to you, Elisabeth. LinkedCare. LinkedCare focuses on interoperability and trust, what have been the biggest challenges in creating shared digital platforms.
That's a complex issue. Let me focus on the 2 main aspects. The technical issues are sometimes less complicated than the different mindsets and responsibilities within the healthcare system. Technically speaking, interfaces have to be opened so that data flow is possible. However, a sensitive approach is necessary when dealing with different perspectives and legal frameworks between health professionals. Sharing individual health data is subject to high ethical standards and must comply with the laws governing all Austria health professions. For example, the prescription of medication and assistive devices is clearly regulated in the laws of the different health professionals. The newly established data exchange system must follow all given regulations.
Yeah, that's definitely a challenge. And then there's the trust issue as well. I would like to go back to unpack that a little, because trust, we know, is so important. People will not use any digital device, any digital service if they don't trust it. And it's also a hurdle, right, to use it. There are many digital platforms. People are already overwhelmed with digitization. We must take this into account as well. So do you have any measures in your project or an experience with testing it with clients or something like that, or the end user, so that they actually really want to use it and trust it?
When we established the systems, we included the user very well so that we could find out what the needs are. And we did over the whole entire project ethical and legal issues. So everyone, every partner was involved or is involved in ethical topics, but also in legal topics. So we start from the beginning to build up trust and to build up high ethical standards. And that's why we could establish a product or a platform at the evaluation phase in the last half year of our project. We could see that this product or this platform is very stable and trustful. All the health data shared between the health professionals and the pharmacies are highly secure and protected. And so the data flow, the process of data flow is in a secure way. So we did a good job, I think.
Yeah, you did. And Donna, what lessons have you learned about scaling digital innovations at the NHS in real ecosystems?
Oh, we've learned a lot of lessons over these years. I think the main one from my perspective is about when we found a digital tool that works and is delivering better outcomes for our citizens, that's delivering better outcomes for our health and care workforce, then it's about moving those from pilot to scale. So one of the biggest lessons learned, I think, that we would like to share is that bit about, don't just keep doing more pilots. Don't keep doing that. We need to, when we know that something works, we need to work really hard then to scale that up by weaving it into everyday practice so that it becomes the norm. That's like the holy grail. How do we actually embed this so that people stop noticing the digital aspect of it and it just becomes how we do our business in this particular health and care service delivery? So that for me is the critical part. We need to concentrate on that embedding within standard day-to-day practice.
That's very interesting. So, what role do patients and informal carers play in shaping and trusting these systems, Elisabeth?
Patients or clients, as we name them in the mobile care setting, play, of course, a crucial role even in our project. Of course, the informal caregivers are a cornerstone of managing the Austrian healthcare system. Both groups can be sure that our system adheres to the highest ethical standards and data protection standards. And in future, both groups will have the option to be integrated in the system directly. Now, at the state of the project, the health data from the clients are integrated in form of the health care providers. They are involved in this project.
Donna, how do you build trust among citizens and professionals when introducing a new digital tool?
Well, again, this is a really challenging area because for me, trust is actually the currency of digital health. Without trust, no digital tool will become embedded into the ecosystem. It just won't. If people don't trust, who's using their data, where it is. That you gain that trust for me in one or two different ways. You need to be transparent right at the start. So what kind of data are you using with that digital tool? Where is that data sitting? Who is accessing it and for what purpose? And really critically, particularly in this age, what are the safeguards that are in place to protect that data? That's really critical now. And if we're very transparent about that right from the start, then I think that helps to build that trust. There's also involving end users. And by that, I mean, it could be patients, it could be health and care professionals, clinicians, whoever's actually using these tools. They're actually involved at a very early stage in co-design and piloting and that open dialogue about how this can be embedded into their workflow and how it will improve their workflow or indeed their experience of that health and care system or service if they are a citizen. Often we pay lip service to co-design and we do it a little bit here and there and tick a box, but that's really not how that works. It really should be throughout the whole development process and indeed the scaling up process to embed it. A final point is really about reliability, that we need to make sure that for our health and care professionals, if we are going to embed digital tools into their workflows and into their settings, we need to deliver really reliable tools that actually improve their, as I was saying earlier, their work and their ability to be able to do their jobs safely and to a high quality. And that's, again, going back to the co-design. You need their input to that to make sure that actually the tools that you're delivering are doing that.
Isn't that one of the main challenges? What do you think? How can we make sure it always works? Is that even possible?
Sadly, I mean, I think there are great efforts across health and care systems, across Europe and internationally, in that very point about system resilience and trying to make sure that we're protecting data, we're protecting the technical infrastructure that supports these tools. I think sadly in the current climate, we are looking at even more efforts going into that. However, what I would say is that if we look back on our experience of COVID, the COVID pandemic, that really did impact across the piece on our health and care systems in many ways. And sometimes when that happens, it really does make the system stand up, make people and professionals that are delivering the services stand up to be resilient and to find other ways of working and to be agile and do that very quickly. And so I think that, yes, we do need to be as vigilant as we can. We need to put in measures, as many measures as we can, to try and, avoid that breakdown in the technology not working. But the reality is it is going to happen. It's inevitable that it will happen. And it's about how we are not only prepared for that, but everybody being quite resilient. And I think that will be a challenge that will remain with us for a long time.
We jump back to Norway. We know that in Austria, very often we have this problem that the national strategy and the local implementation clash. How do you balance national strategy with local implementation when it comes to digital services?
I don't recognize this as a clash, actually. I think that
And maybe it's not a clash in Norway.
yeah. I mean, that's what I mean. Yeah, that's what I meant. I don't recognize that. But I think the Norwegian authorities, they were quite early to have a national strategy for e-health. But not only did they make a national strategy, because that can, very often that can be something that's not very useful. But I'm not saying it isn't, but it can be put in a drawer sometimes. But also they developed a welfare technology program for the whole country, where all the municipalities have been, become part of that as the years went by. So it's for more than 10 years, this program has been working. And also they have training programs on a very local level. So I don't think that's the problem. But there are other challenges. Like, for instance, I think that a lot of municipalities where that's where it's going on, that's where the practice is. I think that they feel that maybe the authorities could have been not so reluctant in saying how they should do things, what technology they should use, and things like that. But I think that this is moving so fast. They're reluctant to, be too specific about what the municipalities or the practitioners should do. And maybe the result of that is that the municipalities are sort of waiting for the authorities to say something. The authorities are thinking, well, isn't it good to have autonomy? You can find the solutions that you need. And so this is slowing it down, I think, a little bit, because everyone's waiting for everyone else, sort of.
That's very interesting. So, Elisabeth, one lesson Europe should remember about digital ecosystems, in your opinion?
One lesson Europe should remember about digital ecosystems is the need to balance innovation with regulation. It is crucial to encourage growth while safeguarding fair competition and user rights. Especially the respect for user rights are really important.
The respectful user rights. So, Etty, one myth about digitization in health and care you want to bust?
Well, I think that I can return to my examples. Knowledge about technology and how it can help you can turn things around. I have seen this in the research that we do. There was one nurse that said, it's quite unethical not to offer these elderly people this technology. We use it all the time.
If you have it, yes.
Yeah, but
And
she
yes.
meant that, she
Mm.
used it all the time,
Mm.
or younger people use it all the time. Why shouldn't they have access?
And what do you think about the choice? We just discussed that choice could increase the trust.
No, it's difficult not to agree with that. But it is a dilemma, because we see now in other areas, like in finance, for instance, that in Norway we don't use money anymore. We only use digital or cards or phone or whatever to pay with, and this is absolutely a challenge for a lot of people. So, and I don't think that they find that they have a choice. So
That's
yeah.
absolutely right. So maybe they want to protect this choice in healthcare because it's even more personal, right? More personal than your financial data is your body and your
Yeah, absolutely.
your
But
dignity and
one myth though might
yeah.
be that maybe it's not so dignity breaking as you think, or not, it doesn't really involve that much
It
breaking your
doesn't have to say
privacy as
yes.
you might think. Yeah.
Yes. One aspiration for turning digital health and care from vision into practice.
Well, I think that authorities and politicians, to a higher degree, must understand that this has to come with resources. I think a lot of politicians and authorities see it as a way of saving money, but that is not really true. It's not going to happen because it costs a lot of money. And the reason why we are, well, not one reason, but part of the reason why we're introducing this is because we are lacking hands. We're lacking, people that can do this job. So we need to help out with technology a little bit. But then that needs to come with resources.
So this is another myth that it saves money.
Well, at least in the short run, it rarely does, because it costs money, of course. Technology costs money, but it also costs a lot to implement it, to teach people to use it.
Training,
And
yes.
yes, so if at all, it takes a long time before you have a savings.
And it's also a very unhuman argument to always say it saves you time, it saves you money, because that's exactly what causes what you said, Elisabeth, that people then think that this lacks the human touch, we cannot trust it, and it replaces human interaction, which is a total nightmare for every human, right? We are social beings, we want to interact. Well, on the other hand, it's also always difficult to interact with other people. We never know what to expect,
Yeah,
right?
that's
A
true.
lot of people are actually also afraid of doing that. But as a social species, we need it. When we need the warm hands, we need the hug, we need the touch. And I think you made a very good point, Elisabeth, in saying it actually never replaces the human. That's a very good point. Donna, is there any wish for the future of digital health and care for our listeners?
I hope that we don't have to have a podcast like this talking about digital health in the near future, because for me, I would like us to get to a point where digital health is invisible, because it's just the way that we deliver health and care. Nobody's actually talking about digital health anymore. That would be my wish for the future.
So may your wish fulfill. So is there anything you would like to leave us with? Any final words for the podcast today?
Well, I think I'd like to comment on what you were just saying about needing the human touch, or being a social being. We're talking about healthcare here. And so I think that life is, a lot more than that, thankfully. And so
Hopefully
the being
so.
social and interact with others could also be taken care of outside of the healthcare domain. You substitute some of the healthcare personnel with technology that you're not going to be with others. Yes.
That's absolutely right. But from experience, I grew up at a doctor's clinic in the Austrian countryside. And I know because it's very close, and everyday patients come and you help, you know? And one time I realized actually 80% of my father's patients come to him to talk.
Oh.
So it's actually connected, right? As in many people, they don't actually have a health problem, but they need the human interaction. And you're absolutely right. We do not only have to provide it in the healthcare system. People should help each other. They should talk to each other. It's actually a little bit sad if you have to go to the doctors to talk, right? So thank you very much for the wonderful conversation and being a guest on the THCS podcast. It was a real pleasure. Thank you very much.
Thank you.
Thank you very much.
You've been listening to episode 5 of 6 of the THCS Podcast, Ecosystems in Health and Care, a podcast about the future of health and care in Europe, told through the voices of the people making it happen. Each episode brings together real-world ecosystems and visionary experts who are breaking silos, building trust, and transforming systems. One aligned action at a time. THCS stands for Transforming Health and Care Systems and is a 7-year initiative funded by the European Commission. This podcast is produced by THCS Work Package 9, which focuses on strengthening ecosystems, the key to tackling the complex challenges of today's health and care systems. Because collaboration is not the end of innovation, it's where real change begins. If you liked this, we have more for you. There are 5 more episodes on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts from. See you in the next one. Ecosystems in Health and Care, the THCS Podcast.